Hi everybody, my name's Rachel.
And my name's Marcia.
And today we're going to be practicing vital signs. So one of the things you're going to see in this video is we're actually going to make a lot of mistakes. And what we want you to do is see if you can find our mistakes and see if you know how to correct them. Hi there. Are you Marcia?
I am.
Excellent. Hi Marcia, my name is Rachel. I'm going to be your nurse today. Do you like to be called Marcia?
Yes.
Okay, perfect. So I'm going to start today with your vital signs. Is that all right?
Sure.
Perfect. Can I have you remove your mask so I could start with your temperature? Great. Thank you so much. I'm just going to wash my hands. All right. So I'm just going to do your temperature here under your tongue. Okay. Perfect. I'll just hold it here, and it takes a minute. Perfect. Okay. I'm going to throw this in the garbage. So the next thing I'd like to do is just check your pulse. Okay. All right. Okay, I'm going to check it up here. Okay, so now I'm just going to count for about 30 seconds. Okay, that's perfect. Could I get you to put this on your finger? So this is going to check your oxygen. All right. And the last thing we're going to do is check your blood pressure. Do you have normal blood pressure?
I think so.
Excellent. Okay, so let's just put this on and see how this goes. How's that?
Okay.
Okay. There we go. It's going to feel quite tight. Okay, this is perfect. Just going to put this away. I'll just silence that for now. Okay, so your blood pressure is showing a little bit high today. So we'll have to talk to the doctor about that.
What is my blood pressure?
130 over 85. Okay. All right, so we're all done for now. So I'm going to report these vital signs to the doctor and then I'll come back.
Okay.
Perfect. Okay, everybody, so you watched our video, so let's start from the very first thing. So we introduced ourselves, we obtained consent, we made sure that our patient was comfortable with what we were calling them based on our chart. And then the next thing we did was we went to do temperature, and I asked Marcia to remove her mask so that I could check her temperature, and there was one thing that Marcia did that made her temperature inaccurate. And Marcia, what was that?
So I took a sip of coffee, so that is going to make the temperature inaccurately high.
So right away at that point, I wouldn't be able to do her oral temperature, so I could opt for tympanic, or I could wait a period of time, perhaps finish all of my other vital signs before going back to do that temperature. The next thing I did was take her pulse. So for checking a pulse, it should be the radial pulse. Even if you're using one of these lovely Welch Allyn towers that do a pulse with the SAT, it does not tell you the rhythm and whether it's regular or irregular. So you still have to palpate a pulse, usually the radial. And I made a mistake here as well. When Marcia put her hand out, I actually went over to the ulna. And so this is the radial pulse, easy to feel, and this is the ulnar pulse. So we want to make sure, very difficult to palpate the ulnar pulse. In many people, you can't feel it at all. I did do the right thing though next, which was default and go up to the next pulse, which was the brachial. Next, I put on the O2 sat, which was fine. I just clipped it onto her finger. There was no issues with that. And the last thing I did was put on the blood pressure cuff. So did anybody catch how I put the blood pressure cuff on incorrectly?
So the blood pressure cuff was put on upside down, and my arm was in an inaccurate position as well. So it was left down below level of the heart. So it should be up and supported.
So when we talk about the blood pressure cuff, so first of all, it says right here, artery marker. Make sure that the artery marker goes over the artery. What artery? The brachial artery. So when we check, we want to make sure we have a brachial pulse, which is right there and easy to find on Marcia. So then we have the artery index, and we're going to go around and make sure that it's secure on her. This is a good size for her, and that can be measured if you're not sure. The next thing we want to do once we have the cuff placement properly, I just want to fix this a little bit. There we go. Is we want to make sure we rest the arm on a solid surface. So in this case, actually, from how she's sitting and the solid surface we have available, I probably want to grab a pillow or a blanket or a jacket or something so that when she rests her arm down, it is nice and relaxed. She's not using this muscle at all. I can double check my placement once I've moved around by double checking this brachial pulse. And once I'm happy with where we're at, then I can do a blood pressure. And so the outcome of misplacing her blood pressure was that it actually read that her blood pressure was higher than I would have expected. So it wasn't a reading of hypertension, but it definitely was a reading that was higher than what we would have expected. And that's likely because improper cuff position, improper arm placement, and that muscle being used while we're doing the blood pressure. So important things to remember when you're using this machine. It is much more critical that you put your equipment on properly and that your patient is situated properly, because the machine is catching not only the pulse, but also it can catch muscle movement and pick up other things. So if this isn't working, then you do have to default back to your traditional blood pressure cuff. Placement still becomes a priority. So if you're not sure that this is accurate, always default to your manual.
And lastly, when your machines are alarming, pay attention to what they're actually saying to you, because it may be a cue that something is inaccurate.
Hope that helps.